Okay. All right. I think we're ready to go. So first, I want to welcome everyone to the Pathways to Wellness Accessing Care webinar series. The Health Council of West Central Florida put this webinar series together with the goal of addressing knowledge gaps for all individuals, regardless of health insurance status. Today's webinar will feature a panel discussion with representatives from different agencies across Manatee, Polk, and Hillsborough counties. The discussion will be focused on how their agencies and programs work to ensure individuals in their county. During their presentation and during this kind of like introduction phase, we will disable the chat. If you do have any questions that come up as they present their own work, you could put that into Q&A. That way we can kind of monitor that as it comes in. And so that will kind of be the flow of things as well. And then after I'm done with my introductions of each panelist, then Teresa will kind of steer the panel discussion moving forward. So next we have sorry, let me minimize this. We have our webinar series disclaimer. So the views and opinions expressed in this webinar are solely those of the presenters and do not necessarily reflect official policy or position of the Health Council of West Central Florida. The information in our webinars and e-materials, digital recordings, and any other materials like a resource list that will follow is for general information and educational purposes only. We are, sorry, I lost where I just was at. Okay. Nothing contained in these materials is or is intended to be construed as advice, and we are only providing you with techniques, tools, information, insights, and educational material to assist you in your personal life and navigation of accessing care or health insurance. Our first panelist, we have Jeff Cords from Manatee County. He is the Health Information Services Manager. Jeff currently leads health-related efforts in Manatee County as the Health Information Services Manager. Alongside his team, he coordinates a wide spectrum of local health efforts, including indigent care, facilitating nonprofit investments, overseeing behavioral health services, championing substance use disorder prevention response, and spearheading local homeless response initiatives. Before joining Manatee County, Jeff had held several senior health-related roles, including Disease Control Director at the Florida Department of Health, Corporate Compliance Officer, Risk Manager, and Safety Officer at MCR Health, Chief Compliance Officer at All Care Options, and Director of Health, Safety, and Procurement at Lake Erie College of Osteopathic Medicine. He is also a highly decorated veteran of the Florida Army National Guard and having served with distinction for nearly 21 years. So thank you, Jeff, for joining us today. Next, with Manatee County, we have Annie Brettinger. Annie joined We Care Manatee as the executive director in 2021 after serving 8 years as a board member. She majored in sociology and conflict studies at DePaul University in Greencastle, Indiana. She obtained her Juris Doctorate from St. Louis University School of Law. In 2012, she moved to Bradenton to work as a healthcare attorney at a local law firm. And after over 9 years as a healthcare attorney, she made the jump into the nonprofit world to lead We Care Manatee. Thank you, Annie, for being with us today. Next, we have Joy Johnson. She is the Health and Human Service Administrator for the Polk County Board of County Commissioners. She has served Polk's residents for more than 20 years in various roles throughout her tenure with the county. Joy oversees the county's healthcare safety net, which in large part includes the Polk Healthcare Plan. Her lengthy volunteer service includes working with various organizations, including Polk Vision, Florida Department of Health, United Way of Central Florida, Transportation Disadvantaged Local Coordinating Board, and the Florida Association of County Human Service Administrators. Joy's efforts in implementing innovative, effective county government programs that strengthen services for residents has been honored and recognized at both state and national level as best practices. Thank you, Joy, for being our representative from Polk County. Next, we have Philip Conti. He is the Healthcare Services Manager for Hillsborough County Healthcare Services. He is responsible for a team of case managers who determine eligibility for the healthcare program. He has been with the county since 2008, and his prior work was based in New Jersey, where he supervised case managers for the Division of Developmental Disabilities, along with providing emergency mental health crisis intervention at Capital Health System in Mercer County, New Jersey. Thank you, Philip, for being here with us today. And last but not least, we have Autumn Mrzeko. She is the program manager for the USF College of Nursing Mobile Nurse Medical Clinic, a nurse-led mobile health unit that provides healthcare to underserved areas of the Tampa Bay region. In her role, Ms. Mrzeko managed the launch of the mobile health unit from the inspection under Dr. Usha Menon, Senior Associate Vice President of USF Health and the Dean of the USF College of Nursing. Currently, Ms. Mrzeko oversees the operation of the mobile health unit, including coordinating services, sites, and partnerships. She also has robust experience in health operations and practice management, and co-led a team that launched the first primary care practice for FAU's College of Medicine. So thank you all so much for being with us today. That is kind of my introduction of their bios, but they will do their own overview of their work. So we will begin that with Jeff, if you could start us off.
All right. Are you seeing the presentation, Ismail?
Yep, I see it.
Awesome. All right. So thanks so much for the Health Council of West Central Florida and our fellow panelists for being on the call today. Thanks also to our colleagues across the region that are doing amazing work out there, and most importantly, thanks to you who are just looking to learn more about the healthcare system here in the region. I've got a couple slides. We're going to highlight a few of the programs and initiatives that we have here in Manatee County, and talk through how they're slightly different from other programs in the region. All right, so my team and I in the health service section, we focus on many different aspects of the healthcare industry, but we target those individuals that can't afford healthcare for themselves and their families, and what that looks like is very different from household to household. So I think it's extremely important to take that into consideration. I think there's no adage that journey 1,000 miles starts with a single step. And I think if anything you take away from this presentation, it's that initial step is what's most important. It's starting, the health and wellness journey as soon as possible, because I think what we find, especially here in Manatee County, is a lot of individuals don't know where to go, and that leads them to not go out and look for care. So we want to give you a couple resources that you all can utilize to provide or to receive care here in Manatee County. So my team and I, we look to eliminate barriers and coordinate a system-wide network of programs and initiatives. And I think one thing that's extremely important to note is that healthcare looks different in every single county. So each of our 67 counties in the state of Florida is completely different. And one thing that some counties leverage is a indigent surtax, is what it's called. That means that both the elected officials and the voters have all agreed and approved upon the collection of tax money that goes towards specific health initiatives. And in Manatee County, we do not have a surtax in place. And so what that means is we don't have a pot of designated funds available to utilize for these different programs and services. And why that's important is because it just means that we need to be a little bit more strategic, opportunistic, thoughtful, intentional with the money that we do receive and the initiatives that we support and focus on. So I would say if you describe, the healthcare services in Manatee County, they're agile and they're lean. And we look to leverage partners with different organizations to make sure we have these enterprise solutions that serve the greater community where we can. So with that being said, I'll take a quick rundown of our healthcare plan here in Manatee County. It's considered a payer of last resort. So what that means is for adult individuals that currently are full-time residents in Manatee County that aren't eligible or don't have access to any state programs or federal programs, Medicaid, Medicare, any third-party insurance that you might have through your employer or otherwise, or the marketplace. and you have a limited household income, you may be eligible for this program. And I talked earlier about leveraging community partner. We have a couple access points, and we utilize these community partners to make sure individuals have different resources where they can go to and get access to the program. So our partners at Turning Points and WeCare, MCR Health, and the local Memorial Hospital system, as well as our own team, can help individuals to be enrolled in this program. And during 2023, we served over 1,200 clients and processed over 9,400 claims. The sole role of that is we saved individuals from paying about $5.3 million in healthcare spending that they otherwise would have had to shell out of their own pocket. So the healthcare plan is there, it's available, and the board has been approving that for many years now, and we look forward to continuing to grow that program as we move forward. The next program I think is really innovative in Manatee County is our community health team, which is housed underneath the Emergency Medical Services Division. And like I said, that innovative team of proactive healthcare providers and social workers try to eliminate the burden on our emergency response and our healthcare systems. And those individuals, they target specific clients, for example, individuals who frequently fall, those individuals with mental health and substance use disorder as well. And just recently, this past year, we've layered on a program called CORE, which is our Coordinated Opioid Recovery Network. So Manatee County was lucky enough to be one of 12 counties to be selected to participate in this program. And it's pretty cool. It deploys a nurse practitioner and a registered nurse alongside of a resource coordinator. And those individuals engage individuals following transport to an emergency room for following an overdose, and it tries to link them to long-term recovery services. So really neat program there. The community health team also focuses on things like congestive heart failure and individuals with chronic respiratory conditions, diabetic patients, and then also our high system utilizers. And so those are individuals that contact the emergency communication system or the 911 system that frequently utilize the ambulances provided by our Emergency Medical Services Division, and then frequent our emergency rooms for different programs and services. So this looks different from many different clients, but a lot of those individuals may be unhoused. So we also have homeless outreach case managers that go out into the community and try to reduce those numbers for us. And the great thing about this program is it's completely free of charge to individuals that are enrolling in it. They can provide things like home visits where they'll come out to you to ensure that you're receiving appropriate, or you have a safe haven where you can be in a healthy environment. And all it takes is a referral on the website. So individuals can obviously call, but that referral page is most important. And what's great is they have no wait currently. So if you put in a referral for your mom, dad, sister, brother, they'll receive a phone call, within 24 hours to schedule that first appointment. And the goal is, again, significantly reducing the cost burden on both the clients and the healthcare system as a whole. So last year, they processed over 1,600 referrals and diverted 450 hospitalizations, which is huge because obviously we all understand, the significant cost that comes with going into an emergency or an acute care facility like that. So also reduced ambulance transports and staffing days by 27 days. And then, save $750,000 directly to the clients and the healthcare system as a whole. So really great team over there. I would consider them almost like a Swiss Army knife of healthcare providers. So they do really strong work. And I also talk about our community partners. I think it's really important to highlight what they're doing. We manage contracts for numerous different programs and services. And I spoke previously about the importance of building out that continuum of care. And I think this is one of the reasons we're so successful is because of our community partners here in Manatee County. So last year, we provided almost 7,000 clients with no cost medical and dental care. Almost 1,000 individuals received mental and behavioral health clients received services given at no cost to them. Case management and advocacy services were close to 8,000 and 18,000 emergency shelter days for those individuals that are unhoused. And this is really amazing because the total cost of this was about $1.8 million to the county. So significant reduction in the amount of money that you would normally spend by leveraging those key partners. So And I just wanted to highlight a few of them here. I talked briefly about the Emergency Medical Services Community Health Team in your top left. We also have our partners in Turning Point and we're at WeCare, who's going to talk shortly. Turning Points provides free dental care, primary care, and specialty services. And our partners at WeCare will provide resource coordination and specialty care as well, again, free of charge to individuals who qualify. And I'd also like to give a shout out to our partners at the Florida Department of Health here in Manatee County. They do great work. We also have Centerstone that provides behavioral health services here to the community, and our federally qualified health center, MCR Health, who has many facilities throughout the entire region. And again, all of those organizations have some kind of a discount program or sliding scale fee based on the amount of income you make. That's the amount, comparable amount that you'll have to pay for those different services. So if you're looking for a place to start your health and wellness journey, these partners right here are some of the individuals you should probably be reaching out to. And that's all I have. I'm going to pass it back off to Ismail. The contact information here, and I think it's going to be sent out afterwards as well. And I'll hold there to see if there's any questions before we move on.
I didn't see any questions come up, but we will transition now to Annie. Thank you so much, Jeff, for sharing. Annie is also with Manatee County, so we'll hear some more about their program at WeCare.
All right, let me, I'm going to kick Jeff off of his screen sharing and go to mine. Oh, hold on a minute, sorry. All right, can everybody just see my presentation now?
Yes.
Okay, and it's the big one.
Yes.
Right.
Yeah.
Hi, everyone. My name's Annie from WeCare Manatee. I am also in Manatee County with Jeff. And some of you may have WeCare networks in your county also. WeCare is a model. We are not affiliated with each other. They all kind of take different shapes and forms to meet the needs of each individual county. But it is a model that holds consistent for how we provide care to people. So I'm going to tell you a little bit about how WeCare Manatee works. Our patient population is low income, uninsured adults. They must live in Manatee County, and we connect them with free quality medical care and resources. And our main focus is specialty care. To be a client of WeCare Manatee, you must be a Manatee County resident. We do serve undocumented population. They just need to show us that they are a permanent long-term resident of Manatee County. They must be under the 200% federal poverty level. And there's some numbers for your reference just to understand how low that number actually is and how many people we do have to turn away for being over income. They must be fully uninsured, no Medicaid, no share of cost, no private health insurance. We work in tandem with the county program that Jeff talked about before. So a lot of our patients do have both WeCare and that county insurance. And they must be over 18 years old. So what I'm going to do today is really explain how a WeCare network works. So that you all are able to identify patients that would be a good fit for us and to just give patients an understanding of really how it works. So the goal with our WeCare network is to get our patients connected with free specialty care. And that first step is to establish a primary care doctor. We promise all of our volunteer physicians that our patients will have a primary care doctor working as the quarterback for their care. So the first step is establish with a primary care. We do help a lot of people make that establishment with a primary care doctor. We help them work through if MCR Health, our federally qualified health clinic, is a good option for them, whether it's a free clinic. We really help people get established with primary care, but we make sure that we have that primary care doctor be a quarterback for the care, run the initial labs, run any imaging that needs to be done, and they really tell us at WeCare what specialists need to be seen. So step number 2, the primary care doctor makes a referral to WeCare Manatee. So we'll say one of our patients, we'll call him Steve. He goes to his primary care doctor. Primary care doctor runs labs, does some imaging, and says, you know, this reoccurrent sore throat might be more than just sore throat. We need you to see an ENT doctor to rule out any potential cancer or something more serious. So that primary care doctor puts together a referral that includes specifics of Steve's previous workup, labs, imaging, sends it directly to us at WeCare and says, this is Steve. He doesn't have insurance. Here's his previous medical information. Please connect him with an ENT doctor. Next step, WeCare reviews our referrals every day. Every morning we go through our referral batch and we do an initial review. Does this person live in Manatee County? Do they have insurance or not? And are they looking for a specialist that we have? Unfortunately, we don't cover every specialty available. For example, we don't have rheumatology. We have very limited dermatology. So if it's something that we don't have, we just reject them out of hand. We don't like to string people along, you know, and enroll in our program when the care that they need isn't there. So we do an initial screen where it looks like, yes, this person is a good candidate that we can help. So then we go back to the primary care doctor and say, yes, we can help this person, or no, we can't. Step 4. I know these are a little simplistic graphics. It's kind of the point. Step 4, the patient comes to our office and enrolls in the program. We do have them come in person. We do need signatures on a lot of paperwork. We like to make sure that people are also invested in their care and able to keep appointments. We have found greater success explaining the program and getting buy-in in an in-person, more relaxed environment to make sure that this is a good fit for our program. We enroll the patient in all the appropriate programs right here while they're with us. There is no wait time. There is no mail away. We'll get back to you. It's something I'm really proud of for our program. They come in and apply, and they just wait about 10 to 15 minutes while we do all the paperwork, make sure that they are a match. Mostly financial is what we have to do while they're waiting. We run all their finances that they bring in and say, yes, you know, you do qualify for the WeCare program. We explain all of the rules and regulations of being a WeCare patient. And then we say, all right, great, you're approved, out the door. Next step, we send all of their medical information directly to the doctor they needed to see. So in our example, Steve, who needed to see an ENT doctor for his recurrent sore throat, we send all of his referral information and all of his approvals straight to our volunteer ENT doctor. That volunteer ENT doctor then reviews all of the medical information and all the paperwork that we've sent him. And 9 times out of 10, they do accept that patient to be seen on a volunteer basis. That patient then sees the specialty doctor in that own doctor's office, just like a paying patient, and the doctor does not charge the patient and volunteers their time. So it's really nice because once they're out the door, the patient is treated just like any other paying insured patient. They're seen during regular hours with full staff at the doctor's office. And it's just a really high quality experience for our patients. Our program has a few different pieces. What I've described just now is mostly this VHCPP volunteer physician program. The physicians operate with sovereign immunity from the state of Florida under their volunteer program. So that's a really nice benefit that they receive. We also have a robust breast health program. We have a private fund that's able to pay for screenings, diagnostic, biopsies. We don't look at income for this program, and it is privately funded. We also, through the Manatee County nonprofit grant program that Jeff discussed, we have a pharmacy program so that patients are able to really realize the full intent of the doctor's visit. So in this example, Steve, who saw the ENT doctor, if that ENT doctor has a prescription, WeCare Manatee is able to cover that prescription for Steve up to $400 a month. It only works for our volunteer physicians. You know, it won't be able to fill primary care prescriptions that are given, but it does make certain that then the specialty doctor's full scope of care is able to be received by the patient because we can pay for those prescriptions. And we also have a new program. It's called Care Connection Manatee. This is my last slide. We all have hired a social worker to really be a point of a starting point for people in Manatee County where they don't know what to do or where to go to get care while they're uninsured. We see people every day get sicker because they don't know where to go, spend money unnecessarily when there was a program available. Spanish speakers not being able to get services appropriately in their language. And so Care Connection Manatee is really starting a movement to be the gateway to care in Manatee County, where we can get people going the right direction, apply for Medicaid if it's something that they are qualifying for, and just help with other social needs such as food stamps, food banks, and other socioeconomic programs that they qualify for. And that's it for me.
Awesome. Thank you so much, Annie. We will now move on to our next county. So Polk County. So Joy Johnson will be talking to us there. Are you able to share your screen?
I am.
So, all right. I already see it.
Here we go. All right. Good morning, everyone. Almost good afternoon. Thank you for asking me to be part of the panel. I'm happy to talk about the program here in Polk County. Some of you may be familiar with it, but not knowing the audience and where everyone is from, I'll just take a few minutes to speak to our geographic area. We are along the I-4 corridor between the Tampa-Orlando market. Our population is close to about 800,000 people and growing. We are the fastest growing county in the state, fifth fastest growing county in the nation. In terms of the size of our population, we're the fourth largest county in the state. Our uninsured population fluctuates anywhere from 12 to 16%. Subjective, again, that fluctuates from year to year with the census data. We have a number of different service delivery models, but for today's conversation and for the simplicity of it, I do want to focus on the Polk Healthcare Plan. We are part of our Board of County Commissioners, so that is the structure that we operate under and that oversees and administers this program. So just to give you an overview, again, this is what we refer to as our local healthcare safety net. It's not health insurance. It's not Medicaid. We have nothing to do with the Marketplace, Affordable Care Act. What we continue to educate our community is that this is health coverage. So for someone who's uninsured, when they access any program that we're administering, they're not considered insured. We're covering that uninsured population. It is supported through a local voter-approved half-cent indigent healthcare sales surtax. Kind of what Jeff was speaking to earlier. We are one of those counties that has a voter-approved sales tax that funds the Polk Healthcare Plan and other programs that we fund and contract to deliver in the community. It is locally administered and it has local oversight, which I think is one of the greatest aspects of this program. There is investment and buy-in in our local community. And as we see the needs change, we're able to adapt to that change in a more timely manner. And especially on the heels of COVID, that was very, very convenient for us. So to give you an idea of the benefits that are covered in our Polk Healthcare Plan, we offer a comprehensive network of health services. And as you can see, these numbers do not represent locations. They represent the number of providers, physician extenders, APRNs, you name it. So we offer primary care. We've got specialty care providers. We've got behavioral health providers. We have 5 urgent care groups that we contract with. We contract with all of our nonprofit hospitals in the county. And we have a lab provider. We offer lab, radiology, diagnostic. And we also have a prescription formulary that we offer to members that are in this program. So that's an overview of our network. In terms of covered benefits, it is lengthy. And again, you'll have a link to our website if anyone is interested in learning more. But I just really wanted to list them here. As you can see, the benefit package is pretty comprehensive. not only, as I mentioned, do we have primary care, but that specialty care access is extremely valuable to our community because oftentimes people can get access to that primary care encounter, but if they have the need for follow-up, care to see a cardiologist or a dermatologist or gastroenterologist, oftentimes there are some programs that won't offer that, or there's a lot of hoops to jump through. We have quite a bit of providers that do contract with us here in our county, both that are nonprofit, public, and private providers that will see members that we send to them. So I won't read through this list, but you can see it's pretty comprehensive. And again, this is a safety net. So while we do offer a wide array of services, we don't cover everything. So again, it's a lifeboat, right? Not a cruise ship. Our members, however, also have access to dental services, transportation for medical related visits or needs. We also give them access to the YMCA, a gym membership, which is something that we've done in the past year or two. And they also have access to nutrition education classes, food prep classes. So we are trying to focus more on prevention and early intervention so that we can engage members in our community on the front end rather than waiting on the back end when their health conditions are highly acute, more costly, and there's a lot more to have to tend to. So we're excited to kind of adapt and evolve, and this is a very much an evolving program. This is the foundation of our indigent healthcare program that really got it started. But we do a lot of other services. So while we don't have dental as a covered benefit in our plan network, we have other grants and contracts that anyone who's a Polk Healthcare Plan member can access those services. And we've got over 10 dental access points, for example. So we are working to bridge the gaps based on the needs that are identified to us in creative ways. Next, I wanted to just take a moment to talk about the out-of-pocket expenses for our plan members. We have no premiums, no deductibles. There are minimal copays, and when I say minimal, depending on someone's health condition, they may have no copays, or they may have $1 copay or 3 or 5. We do that to get our members to buy into the services that they're getting because it's quite a bit and it's a value they're contributing toward this program, right? We want them to get a lot in return, but we also want them to understand, that this is something that many others are contributing to this program too. And we just, we're glad to see how this is working for them. In terms of eligibility, so for someone in Polk County to be a plan member, they have to be a full-time resident of the county, no health insurance coverage or any other private medical coverage. Their income has to be at or below 200% of the federal poverty level. So I put an example here. For a household of one, their annual income has to be under $30,120. And even in today's world with inflation and where we're at and the increase in prices for everything, even that bar is still low. So we know that there's a need. And so we do try to work with our population. Even if they come close to that, we have some ways that we can work with people if need be. They do have to provide a social security number, 2 proofs of residency, and proof of income. With this program, we do plan and budget to serve on average 5,500 plan members a month. So we have people come onto this plan and roll off of the plan from month to month because of changes in socioeconomic conditions, their employment, they get a raise, they move out of the county, they move into the county, they get on Medicaid or they get off Medicaid. So anywhere throughout the year, we can serve 7,000, 8,000 people just in this program alone. So currently we are not at capacity. We can serve more people. And once we reach that 5,500 average where we're maintaining it, we're close to about 4,800 right now. We can lift that. So that number is a target and it is a budgetary target. So based on our claims projections, our history, our trending, we can project that, budgeting a certain number for 5,500 utilizing members from month to month. So that's how we come up with that number. And I'll say, let me just go back for just a moment. This program, in terms of the income levels to be eligible, it has adjusted throughout the years. It's been at 100% of poverty. It's been at, 138%, 150. So it's now at 200%. And that is, we have a local ordinance that we operate under based off of the Florida statute allowing us to have this program. And again, if we want to increase that, we would have to go back to the board, and that would be a local policy decision. But I just wanted to speak to that for a moment. In terms of outreach and how we try to connect to people in our community, we have customer service. We have a team of case managers here, both on site, and they're also out in the community. They could see walk-ins. We can talk to people over the phone and help them apply, but we also have an online registration portal that people can apply electronically without even having to come in or have a face-to-face encounter. We also have our case managers out in the community at different hospitals, different clinics, where we think that there's some traffic and an opportunity and where there's room. We will accompany even navigators out in the community and just try to, share that knowledge and build those relationships and rapports. A lot of times it's word of mouth and relationships is where we're going to get the most referrals. We also have multiple navigators that we partner with throughout the community. We support our United Way of Central Florida and have helped them stand up a team of navigators to go out into the community to penetrate and engage with a population that we might not typically engage with. For example, this program focuses on healthcare. They're touching early learning, childcare groups and nonprofits, education, other types of financial assistance. So we may not be engaging with all of those different groups in our community, and this is an opportunity for us to leverage that relationship to reach more. Additionally, we have a relationship with a Family Healthcare Foundation, and their navigators are out in the county as well, referring clients to us that they come in contact with, and helping them apply, complete an application through the portal to get screened for the program as well. We also, I mentioned the Polk Healthcare Plan is the main foundational service delivery model, but we have many other programs through our other delivery model of grants and aid that we deliver or offer to the community. So we have a criminal justice program, which is called Helping Hands. It's received national, state recognition. It's jail transition, community reentry, and oftentimes we are connecting clients in that program with Polk Healthcare Plan coverage as they prepare to reenter the community. They have access to healthcare, transportation, but that program in and of itself, it's pretty amazing because it's wrapped around people who cycle in and out of jail with multiple arrests, on psychotropic meds or need to be diagnosed. They could be in jail or we can receive referrals from the community. We have a number of funding lines that support this program for people in that Helping Hands program. And that is with our community paramedics, our peer specialists. We've got case managers, housing specialists that really assist those clients. So not only are they benefiting from the Polk Healthcare Plan, we have other programs similar to this where they're getting quite a bit of support in that hand-holding to get them re-engaged and established in the community. We also have other free health services. We do have a mobile unit that we have case managers on, and we partner with our local health department here in Polk County. Their team provides medical screenings, and we do eligibility checks, and it's a prevention, early intervention opportunity to go to those different areas of the community that may not have a lot of resources around them and to get the word out. Additionally, and we're actually in the process of purchasing a brand new mobile unit that's going to have a whole lot more medical services offered on it. So we're excited about that. We do have our other assistants for eligibility and other types of programs, and we have a whole list of projects and partners that we can refer people to if there's something close to their area where it's a medical home, may be limited, but may have just the coverage or service that they're looking for. And as I mentioned earlier, we also partner with our cooperative extension services here in the county that's affiliated with the University of Florida for their nutrition education. So we financially support a position that goes out into the community, provides these education classes virtually, in person, food demonstration, and goes over all of these things. Again, the more we can do to try to help people understand and engage in their overall health and to improve their health, shop for food, look for the different labels, what it means, the better off we are. So that's another service that we offer. So here is, again, sorry, it's an example of some of the way that we do engage with getting the word out. We do have the case managers. We have a calendar when we go out on our mobile unit with the health department. They can access that information online. Our case managers, they also collate, as I mentioned, at various locations throughout the county. And the navigators, we also have their phone number here and the website for our United Way of Central Florida. Again, we engage with a lot of community partners because we at the county, we don't provide any direct services other than the case management, the eligibility. So we don't provide any clinical or medical services or interventions. We contract that out. So we do a lot of strategic planning with our partners and stakeholders throughout the community, and we try to stay engaged on every level of every conversation that touches healthcare, whether it's behavioral health, dental health, you name it. It's really, that is a value that we have. It's quite a bit of resources, but those relationships are key. And so again, we don't do this on our own. We need their support. We need them to have the capacity to be able to serve people in our community. And it's extremely beneficial to those who are actually getting served through the program. So I hope that gives enough of an overview and keeps it simple. Again, there's so much more our program does and touches. But this is the main focal point that we try to drive people in to get established, and we can connect them with many other benefits. So I'll turn it back over to you. Thank you so much.
Thank you so much, Joy. That was a great overview. All right, and then we're going to move on to Hillsborough County. We have Philip to get us started.
Thank you. Let me see about sharing my screen. And where is my presentation? That is just not good. You can't see that, right?
No.
Okay. Let's see. Show all window. Oh, okay. There we go. No. No, that's not it. Jeez.
Ismary, can you bring up?
Yeah, Esmeri, could you bring my thing up?
Yes.
I'm really I'm a little challenged here.
Not a
You're
problem.
okay. I got it. I'll try
there we
to
go.
move the slide as you speak, but if you need me to
I'll just say next slide.
slower or faster,
All right. Perfect.
All right.
Thank you. All right. Oh, thank God for you. Yes, my name is Phil Conti. I'm a healthcare services manager with Hillsborough County Healthcare Program. And unless you're from New Orleans, in which case my name is pronounced Conti. I have to change it every time I go to New Orleans. Anyway, next slide, please. Thank you. All right. I always start off like this because we always say this is the best kept secret in Hillsborough County. We are always trying to get people to learn about this, to know about this. So I'm glad that we have the opportunity to present this to a lot of people. Hopefully, the word gets out. Next slide, please. Okay, so what it is that we do is that we provide access to medical care for the poorest and most vulnerable people in Hillsborough County. It acts as an insurance program. It's not a health insurance per se. And we provide services presently to 16,000 people in Hillsborough County. We don't provide any direct clinical care. Next slide, please. All right, we pay for, and what's included in it is inpatient hospitalization at all hospitals in Hillsborough County, whether they're for profit or nonprofit. We pay for primary care, specialty care, pharmacy, behavioral health, and vision and dental. And this is all done, I'm not sure, you can go to the next slide, please. Yes, we do this with our 4 networks of care, Tampa Family Health Centers, or Tampa Family Health Center, and Suncoast Community Health are both federally qualified healthcare centers. Tampa Family Health has 18 locations. Suncoast has 7. We also have contract with Tampa General Medical Group with 14 locations, all of their primary care locations. And we also have a network with Grace Point, which is a specialty provider where they're providing primary care along with the management of psychiatric conditions. What's good about the networks is that, Tampa Family Health Centers are primarily in the urban core of the city of Tampa. Suncoast is in the eastern and southern part of the county. Tampa General Medical Group is all over the place. Grace Point has their single location, but what's good is that all of the clinics and the places where people can go are all in their community. Next slide, please. Okay, to be eligible, you have to be a resident of Hillsborough County. Our income guidelines are set at 175% of federal poverty guidelines, and that amounts to $2,196 a month. When we talk about eligibility, that is take home. We're not looking at gross income. So there are people, and this is where we look at this, there are people who potentially would be, working and could be eligible for this. And there's some overlap between what we have as far as, what we provide and what's provided in the marketplace. So a person potentially could be eligible for a marketplace plan, also be eligible for this based on their income. I think, what we're trying to do is to encourage people to kind of compare, because what we offer may be a better fit for them than something in the marketplace. Something in the marketplace could be a better fit, but they're all things that need to be considered. To be eligible, you have to have assets under 5,000 and have no other health insurance. As it's been said before, we are the payer of last resort. Next slide, please. Okay. So how we apply, you can apply online at hcfl.gov/healthcare. Also can call 272-5040. We have dedicated application specialists that will assist people in providing, providing assistance to apply. Also at our FQHCs, the Tampa Family Health Centers and Suncoast, they have financial counselors and navigators on site to provide assistance with applications for Hillsborough Healthcare Plan. And also we have information out there with the QR code. I think I'm going to show that that may be the next one that will take you directly to the webpage on our county site, and gives you access to our portal. Now, let's see to the next slide. There you go. There's is. A couple of things that I wanted to touch on. We'll do some, we could do some questions later, but yeah, you could take a picture of that if you'd like. One of the things that was mentioned was that I think one of the places, like if you have share of cost, you're not eligible. Share of cost doesn't bother us. We actually like share of cost, because what happens is that, if the person is otherwise eligible, we'll pay the share of cost, and then we go to, it's all behind the scenes, build the balance to Medicaid. Also, our eligibility is for 12 months, in which time then the person has to reestablish their eligibility. And we also do have a partnership with the Family Healthcare Foundation to assist us in outreach and providing some mobility to our eligibility process. Our case managers are not necessarily in the field, but we do participate in a lot of outreaches where we're really trying to get people in. There are probably going to be some questions. Again, we service 16,000 people presently. There's plenty of room for more, and we haven't met a healthcare condition that we haven't been able to treat. So we treat everything. We have access to all specialties, all pharmacy, and this is absolutely no cost to anybody who's eligible. And I will stop there. Thank you.
All right, thank you so much. And last but not least, also in Hillsborough County, we have Autumn with USF.
Hi, I got my camera working after all that. I'm going to go ahead and share my slides here. And get you guys. How's that? Okay? Or are they still minimized?
Yeah, just go to slideshow and put, there you go. There you go. It's
Okay.
perfect.
Well, I'll go this way anyway. Okay, so the first thing I wanted to let everybody know, I think it's important. So I'm the program manager for the Mobile Nurse Medical Clinic at the USF College of Nursing. We are actually funded by Health Resources Services Administration, HRSA, on an approximately $4 million grant that was awarded to our Dean, Usha Menon. Its ultimate aim is to increase access to primary care in underserved areas across the Tampa Bay region. So we actually include Hillsborough and Pinellas counties. And then we have our nursing students training with our providers on the mobile health unit. And patients, they consent when they come aboard to be seen, but that gives them the opportunity to learn what the social determinants of health are, because we know how severely those impact overall health of the community. So I just share some quick snapshots of the inside of the mobile health unit. We have 2 patient exam rooms. One of them is a little bit larger than the other, so there's more space in there for families that can be seen together. We have a waiting area. We have a countertop where we can do point of care testing. There's a restroom on board for specimen collection. And we also have a refrigerator and freezer so we can store and administer vaccines while we're out. So we are completely rooted in primary care. We cover annual exams, sick visits. We do point of care testing, as I mentioned. We take care of school physicals and sports physicals for students. We actually found through one of our partners is Silver Springs K-8, that at one point they had to cancel some of their fall sports programming last year because they didn't have access for the students. Either the time, the transportation, or the money for the students to have their sports physicals completed. And we also do the immunizations, as I mentioned, and then we provide women's care services. So I talked a little bit about covering Hillsborough and Pinellas counties. More specifically in Hillsborough, we're in the Sulphur Springs neighborhood and the Tampa Heights neighborhoods. And they both have approximately 6,800 residents. And then you see the notes there. For Sulphur Springs, about 37% are below the poverty line. And they are also a food desert, and transportation services are extremely lacking. It's actually predominantly housing. And then in Tampa Heights, 56% below the poverty line. And then in South St. Pete, there's about almost 19,000 residents. Overall in Florida, the poverty line, below the poverty line is about 13%. And there it's anywhere from 25 to 50%, dependent upon the zip code. So all said, we see, about 32,000 people have access to us. I will say that we are not getting that number of patients yet, and that's one of the barriers I'll talk about. So please, when I share at the end, it would be lovely if you would take a note of that, because we have our schedule available on our website. We are all walk-in care right now, so anybody can come up to the mobile health unit. Let me go back for a second. Anybody can come up to the mobile health unit and be seen. The additional communities that I meant to mention, Salvation Army. So there's a facility on North Florida Avenue in Hillsborough. They have 162 beds. So those residents are typically supposed to stay for about 3 weeks, and many of them stay for a year. So when we're there, they're getting consistent care. And that's about the same for Tampa Hope, which is located in Ybor. It's a tented community. And then Lutheran Services, we also see refugees that are processed. So I'm going to go ahead here. Some of the trends that we see and can treat, the diagnoses include diabetes as number one, high blood pressure, and then we see, as I mentioned before, a lot of well visits for school or work, physicals. And then our top social needs include financial strain, food insecurity, and transportation. And that financial strain and the transportation are two of the reasons why we have the mobile health unit, because we're meeting patients where they are and we're providing completely free care. We do not currently bill for services. We do not take copays. Anybody can walk up from anywhere. They don't have to be in these locations to be able to receive care from us. We will eventually bill insurance companies, but we will never take a copay. And when we refer out, we refer to partners at TGH and USF Health and other specialty care providers that provide low cost or no cost care services. We have partners with Moffitt. We have partners in American Cancer Society, Catholic Charities, Feeding Tampa Bay. We have wonderful partners in our community advisory board, also from Pinellas and Hillsborough County, Florida Health Department. We really are appreciative of the opportunity to present today because we know how dire the need is in these communities. The amount of suffering that goes on because of the lack of finances. And one of the things that I wanted to talk about was that engagement that I mentioned. So one of the biggest challenges that we have is the transiency of our communities. It's difficult for us to get information about ourselves out there, even though we partner with our communities. For example, in South St. Pete, we're located every other Wednesday at the Sanderland Neighborhood Family Center. And we're out there consistently every week or every other week, but our numbers are low, despite how much our partners there push things out to the community. And part of that is the lack of trust in the community. So, you see a mobile health unit come through and you hear grant funded and they think, oh, well, you know what? They're not going to be here very long. So why should I continue to see them or even start? That is one of our core aims, is sustainability of the program, and part of the reason why we will bill insurance in the future, so we can create that revenue and not leave these communities. I shared a lot of information and I went a little bit around about things. So I'll stop and see if anybody has any questions because I do have a lot more information. I was just trying to keep it brief.
Nope, that was perfect. I don't see any questions come up. So we will continue all these conversations. I'll hand it off to Teresa, who will start the panel discussion.
Wonderful. I really want to express my deep appreciation for all of our panelists for making the time to be here today. And it's really clear that we are fortunate to have these resources in the West Central region. I'd like to set a little context for our audience before we move into the questions and the conversation that we're going to have. And I want to remind everyone who's participating that if you have questions, please enter them in the Q&A portion on the bottom of your screen. We will make every attempt to get to everyone's questions after we've kind of gone through the general group questions. And if we don't get to your question, we will try our best to follow up with you and answer that question for you after the session is over. So some of this is going to tie into things that Joy and many of the others have touched on, but I want to kind of set a context on the broader scale across the West Central Florida area. So census data from 2022 estimated that 11.2% of people in Florida were uninsured. But every county in our region had rates higher than that state average, which ranged from about 11.4% in Hillsborough County to 15.5% in Highlands County. And as Joy had indicated, that is a fluid number, but at that point in time, those were the percentages that came up. Florida has also led the nation in Affordable Care Act enrollments for several years. There's more than 4.2 million Floridians signed up for federal health care marketplace for the 2024 coverage year. And that was a 31% increase from the prior year and a 54% increase from 2022. And in that, Hillsborough County ranked 7th in the nation for Affordable Care Act enrollments in 2023. And as we've talked about, to qualify for subsidies and to make insurance more affordable, the federal marketplace, generally it's 100% of poverty. You must make at least that much to enroll. And new subsidies were introduced through the American Rescue Plan, which offered expanded coverage options for families above the federal poverty level, which reduced rates significantly for people at higher levels of income as well. Those subsidies were extended through the Inflation Reduction Act, but are now set to expire in 2025. So there may be some changes in that coming down the road. Folks that may currently be participating in the marketplace may not be able to do so in 2025. And as our county indigent care programs and our service providers here have indicated, 175% of poverty to 200% of poverty. That's the income standards that make you eligible for services. So with all these resources, who are the uninsured? And you can start jumping in, and if the panel members would like to raise their hands so I'll know who to call on next, that would be great. So who are the
Hey,
uninsured?
Teresa, I'll go ahead and take a
Thank you.
poke at it. Is my audio working better?
Yes, much better. Thanks.
Perfect. Okay, so the last census, I think we had 410,000 individuals in Manatee County. About 25% of those are considered low income. So most of our programs that we're discussing today are right around that 200% federal poverty level. And then another 11.5% are covered by Medicaid. But that leaves roughly about 48,000 individuals in Manatee counties that are uninsured. And that includes the individuals with disability, around 10%. So out of those 48,000 people, what we're seeing is a lot of, we're covering some with the programs that go up to 200% of the federal poverty level, but we're seeing a lot of uninsured people that are working class folks that are 200 to 400% of the FPL. And when those benefits, cliff happens and they make a few dollars more and don't qualify for these services, those individuals are finding trouble accessing healthcare services. And we know the 3 M's of the federal programs. We have Medicaid, Medicare, and the marketplace. But if you don't qualify for some of those, you don't know about them or whatnot, you're still going to find yourself uninsured. So most of these individuals are families, averaging about 4 individuals, 2 adults, 2 children, and again, 1 to 2 working adults in those families, but they still find themselves, unfortunately, without insurance here.
Would anyone else like to share?
Sure.
Bill.
Yes, I'll lower my hand too. We've had in Hillsborough County, we've had estimates of 40,000 people in the county who potentially would be eligible for our healthcare program. Presently, like I said, we're servicing 16,000, which is probably the largest number that we've had since the recession. When the recession hit, it was like the perfect storm. We got inundated with requests for healthcare because so many people lost jobs and lost their healthcare and stuff like that. Our present group is kind of split down the middle, men and women. Men a few more than women. It's primarily weighted towards 40 to 65 rather than the younger people. I mean, we are trying to get younger people in. And one of the things that we're working on is partnering with the university to have student healthcare services be covered under our program as well. So it's really trying to kind of expand that. But that's really, I mean, you know, and what I think Jeff was talking about, people who are working. I mean, you know, I think that's one of the groups that we're really trying to target. You know, again, because I said there is some overlap between marketplace and what it is that we offer, and you know what we offer may be a better fit for others. There's also, I think, a perception by people that you know Hillsborough Healthcare Program is for the you know the poorest of the poor. You know, if I'm working, I wouldn't be eligible, but you know they would be, and you know that's kind of what you know what we're trying to deal with that misconception. But you know it goes anywhere. We have people who are homeless on the street, people who are employed, young people who just you know turn 26 and they're no longer on their parents' health care plan. You know, it really could be anybody. So you know, it runs the gamut. And I'll stop.
Autumn, you serve a unique population. Could you tell us a little bit about who you are serving?
Sure. So we see in different sites, we see different populations. So, for example, when we are in South St. Pete, we're at two places. We're at Sanderland Neighborhood Family Center, where we see a lot of children and families. And then we're at Enoch Davis Center, where we actually see an older population. We do ask if patients have health insurance, but we don't take it, as I said, we don't bill. I would say roughly estimating at both locations, the average number of the uninsured is 65%. And that's across the age spectrum, right? And then with different types of health disparities, I would say 43% in one location are unemployed. But as Philip said, that doesn't necessarily make much of a difference. There can be people who are not insured, who do have jobs. I know we did an LGBTQ plus event a few months ago, and so many of the people worked in different industries there and did not have health insurance. And that's a disparity for them because they are afraid to seek care. So it's good to be able to serve those communities.
Thank you. Annie, would you have anything to add to this?
We're seeing an increase in Hispanic population reaching out for our services. I think that's twofold. We market to them often, running a lot of ads in Spanish and having Spanish speakers here in our office all the time. But our county is also experiencing a large increase in Hispanic population, and a large portion of them are uninsured. So that's the group that we're seeing a lot of increase. And just something that I think a portion of the population that hasn't been pointed out yet is those that no longer qualify for Medicaid, like their kids just turned 18 or had some other kind of qualifying event that they've gotten kicked out of Medicaid, especially with the recent need to recertify. So that's who we see a lot, is people that actually didn't realize they were uninsured until they went to go get care and someone told them, well, you don't have Medicaid anymore. So it is people that have gone through a life transition and resulted in being left uninsured.
Thank you. Joy.
Yes, so our program, what we're seeing is we target the adults because children should be covered under the Kid Care umbrella in some way, shape, or form. But if there was ever a reason they fell through the cracks and they could not get into one of those programs, we could look at serving them, but we really don't have children on the program for that very reason. Those over 65 are on Medicare, Medicaid. And so we don't target those through this particular program, but what we're seeing is just a completely shifting dynamic. The population has changed so much. It's like you threw everyone in a bag, shook us up, and see where, you know, we all settled. And some people have left Polk County. We've got a lot newer people into Polk County who may not be familiar with the way things work, with the program services. For the most part, our population, we're serving people probably mid to late 40s, early 50s, predominantly women. But one of the more controversial topics on that is there is the undocumented population. And, you know, there's legislation out there right now that's, you know, counties would have to be subject to in terms of looking at certain documentation or accepting documentation for a population who's known to be here illegally. So I think that is a dynamic that, you know, those numbers have grown and we know that. But we are limited to the access that we're able to provide and serve that population too. I think the college age group, you know, that's healthcare. Let's just face it, it's not the priority in people's mind today. Their basic needs is what is important to them. And healthcare is not at the top of it. You know, it's their housing, their electricity, you know, gas, getting food, right? So that's what we're challenged with. So this uninsured population's got a lot on their plate, and getting into the doctor and navigating the system oftentimes can be a barrier, an unnecessary barrier or an unintended barrier to them getting care.
Thank you. So I know some of you have touched on this a little bit in what you've already presented, but I'd like to talk a little bit more about what your biggest challenges are for engaging uninsured people in services, and are there misconceptions about the services you offer, and how do you combat that, or how could we combat that collectively?
I'll start and just pick up on what I was referring to just a moment ago. I think a lot of times one of the biggest misconceptions is that we're insurance and that, you know, we fall under all those rules. And it's different because when you're just going out on the road, you're seeing all these vehicles with all these managed care names on them, and there's people calling you, and nobody really wants to, at least from my perspective, engage with a program they don't know anything about. And so for me, it's getting the word out and saturating our community that this is not something we're trying to sell people. They don't have to buy it. There's no front end expense to contribute, right? It's basically a service made possible because of them contributing in this community, and residents voting to tax themselves to be able to support. So there's a huge a lack of knowledge and awareness, and we're doing a lot to try to overcome that. We're going to be launching a new website here in the next couple of weeks that's more user-friendly, more targeted in our communications. We're also getting ready to contract with a marketing firm that actually specializes in healthcare. That can help us speak the language and target the right people. We've done a lot already internally. We've actually done quite a bit, but I feel like we've probably reached the limit in terms of our governmental constraints. And so now we need to start working with others in the community that really can take us to that next level.
Thank you. Autumn, you had touched on trust and building trust as being one of those key factors. How do you do that?
Yeah, I wanted to touch on that too, because following up on what Joy said, nothing necessarily comes for free in people's minds, right? There's always some kind of catch, or down the line, you know, I get this free care, and then what's going to happen? You know, I'm going to be billed. So there's two different levels of trust. Actually, I would say three. One of them for us is in the Black community, because of the historical atrocities, we'll say, controversial, but atrocities that have occurred in the past with clinical trials and things. There's a lack of trust there. Another one across the board, as I mentioned, having to pay for services or having secret fees that come up. For example, you know, you go to the doctor and they say, oh, you need to have your blood tested for this or that, or just a general CBC. Well, then you're giving free healthcare, but then you're sending the patient to have services that they can't afford and rack up the costs. We actually contract with LabCorp to get reduced fees for that, and then we actually absorb the cost of that. So that's helpful, but it's still getting the word out itself that we even do that. And then the third, again, as Joy mentioned, is the undocumented community. So when we're at Lutheran Services Florida and they're processing, they have access to Medicaid. They have certain resources available when they first come in. I learned that because I didn't know that. And we're also working on getting out in Waimama, and there are migrant workers there. And so they're nervous to come on board because they think they're going to be sent back out of the country. And so that's a big, big challenge, and part of the reason why we've actually struggled to go into that migrant and farm worker community.
Anyone else have anything they'd like to offer on the challenges and how to
Sure.
combat the misconceptions?
Yeah, I have, I was writing down a couple of points. I think to add to, Autumn's point about trust, I mean, one of the things that we run into is cultural trust. I mean, and again, I mean, having to, trying to target, Waimama, Ruskin, South County like that is really difficult. One of the things that we've done in order to try to combat that is to partner with Hispanic Services Council, and they have people that are, promotores, that they go into the community, and for us, they're better representatives than, I'm from the government, I'm here to help you, which is like, the scariest thing that you could ever say to anybody. But no, we have cultural trust building. Also, I mean, again, I think I touched on it before. It's more the perception that, oh, this is a poor people program. And, I shouldn't, go into it, or I probably won't be eligible, or there may be some shame associated with it or whatever. I mean, one of the things that I like about what it is that we do is that, the FQHCs and even Tampa, the Tampa General, primary care sites, nobody is, they're not, people aren't treated any differently based on who's paying. So we give a person a card, they give them their card, and, they're treated like anyone else. So, at least we kind of knock that out. The other piece that the other challenge to us is the confusion, and that had to do with a lot of the confusion around, the Affordable Care Act, and, when you could sign, when you can't sign up. How does this relate to that? So when I kind of go into these things, I try to say, here we are, as a safety net, and then there is the Affordable Care Act, and there's this like kind of overlap. So, but, getting that out that's a 24-hour challenge for us to try to get that information out to people.
Annie or Jeff, do you have anything you'd like to add to this?
I would just say one thing we talked about communication, we talked about messaging and trust and whatnot, but the education component is extremely important. So I think it's important for individuals to understand, if you go to the ER, you're paying $2,000. If you go to urgent care, you're paying $200. Whereas if you go to primary care, you're paying $20. And what a lot of our clients do is they wait until that medical condition is so such an emergency to where they have to access through those hospitals, or they just don't know any better. That's where, they see this massive healthcare facility, and they think that's where I go to get care. So it's important that we educate people. Early intervention, prevention, wellness is extremely important, and then accessing the lowest acuity facility possible. Go to your annual wellness checks, make sure you're getting your health screenings appropriately, because that's going to keep you out of the ER, and that's going to keep you from those significant costs that come with those hospital visits as well.
Annie, would you like to add anything?
Sure. I think that some people also assume that they're going to receive low quality care, and that makes them hesitant to reach out. And so we always try to make sure in our messaging that we get the point across that they are going to be seen just like any other insured patient. I know that even, you know, the mobile clinics is a different setup where you are receiving care in kind of a different physical space than other people. But just always making sure that people are treated and given the same respect and level of care that anyone paying would, and making sure that that message is out there so that they aren't hesitant to come get the care, and then hesitant about the actual care given is an important piece.
Wonderful, thank you. I know we've touched a little bit on how Florida's population is changing and growing. And again, I'll set a little context for our participants. Just I know that some of us who live in this world think about this all the time, but but not everybody does. So Florida's population is continuing to grow, and about 655,000 people came into Florida between 2020 and 2022, and that made us the second highest population growth behind Texas. But in 2023, we overtook Texas, and we are now the number one state for population increases. Those increases, however, are not across the state. They have been pretty much concentrated, over 50% of those, just within 9 counties. And in our West Central Florida area, Polk had the highest 2-year increase at about almost 63,000 people, and Hillsborough County came in third at around 53,000 people. And within our service area, the only county that actually lost population was Hardy County. And so that is, while we have that in-migration, most of that tends to be from other states. Within Hillsborough County, however, they ranked 5th in the state for international migration as well. And so that is pretty interesting when we start trying to think through the future of that. But the census numbers also show that some of the areas that are adding the most residents are unincorporated areas, and that's particularly Manatee and Polk County. So again, other problems. Given these increases in population and the additional burden that would place on the healthcare system, which is pretty much under-resourced already, what can we be doing at a systems level to prepare for this sea change? I know that's a big question.
I have one thing, you know, you spoke about that people are moving into unincorporated Manatee County specifically. We use an Uber Health program that comes along with enrollment in our program, that if a patient is unable to get transportation to their program, we provide an Uber ride for free. And that is really helpful for especially our people that are living far away from our city center out in the country, and those that are sharing cars with other family members. So, you know, these people that are moving out of the city, it's a good connection to get back here where all the resources are, and make sure that everybody has equal access.
So I'll add, we too in Polk County, we take advantage of our partnerships that we have that coordinate transportation. So we'll pay for transportation for our plan members and others and different other programs to get to and from. So that really does help, since a lot of Polk County is rural and there's a lot of unincorporated land. But at the same time, I think that's the effort of not waiting for people to go to where they need to go and expecting them to do the utmost appropriate thing at the right time, at the right location. It's, we need to get out and go to them. And that's what we've been trying to focus on, is take the show on the road, have events. So we do work with our Bay Care navigators, United Way navigators, all the case managers, care coordinators, and navigators throughout the county. And we do get together each month, and our team talks about and plans where we're going to target our location and our efforts. And if there's something happening in one end of the county, or whether it's in a city or an area where there's not a lot of resources, we identify what is the biggest need there. And some, you know, we have some redundancy, which is a good thing, but we don't want to have too much redundancy and not offer other things in other areas. So we'll coordinate a schedule, and we'll post that schedule, but we'll make sure that there's coverage, the right coverage at the right locations by working together and collaborating. So it's cooperative and not, working against each other. And that's really helped a lot, but we've still got a lot of work to do. But I think that's the best way that we can try to, using mobile units, going out to people, and just trying to wrap those supports around them where they're at.
Yeah, just to touch on what Joy said, I think timely access is extremely important. And I think a lot of our provider offices provide services from 9 to 5. And as we discussed, we're catering towards the working class. And if those individuals have the option of going to work and making a livable wage for themselves and their families, or going to receive healthcare treatment, they're probably going to be working. And so we need to get creative with the way that we deploy these assets. I think Autumn's got a great program with her mobile unit, but how do we partner with the local business communities to reach some of these individuals that are uninsured? Is there an opportunity to partner with them on, lunch breaks or things like that to make it more convenient to them? I think about a blood bank. I don't necessarily go online and look to donate blood, but if I see one, I'm more inclined to go over there and take advantage of it. And I would just like to say that we have free transportation through the MCAT here in Manatee County. So if anybody does need transportation, the area transit is completely free in Manatee County as well.
And can I just add something? I think the faith-based population is a great untapped potential and resource that we've got a lot of work to do, because a lot of times that's the trusted resource that people go to. And so we're working to try to make sure that we are getting boots on the ground and making the right relationships, so that when people do feel, courageous enough to actually, ask the question or talk about what's going on, those people, those trusted people in the faith-based community know who to contact, and, trying to bring those services there. I think that's a great way to try to reach that population too.
Excellent idea.
I just wanted to jump in and say one thing, if you don't mind. I absolutely agree. And I wanted to share that because 2 of our most successful events have been at faith-based organizations, because they are trusted entities in their communities. So, based on our experience, if you can, I really encourage that. And then the other thing I was going to say about the 9 to 5 working, that's something else we've hit. If a child is sick, their parent has to take the day off, what do? So we actually are able to provide consent forms to parents ahead of time and see their children when we go to schools and park in those parking lots.
Well, we do have something in the question and answers from Kim Ross with Whole Child Manatee. Does anyone host open enrollment events in their communities to possibly increase those who are access to coverage for those who are uninsured?
I'll start with Manatee. We don't actually do open enrollment. I think that's a great idea that we'll look at. The only challenge is, open enrollment traditionally means you have this time period to enroll. That's it. So, maybe we could rebrand them as something, community enrollment, community outreach enrollment, something like that. Just again, the messaging is so important. We don't want to tell people that it's limiting the time period when they can enroll. But I think that's a great idea. We need to bring it to, anywhere that we can enroll these individuals in the community where they're at is a great opportunity to engage and educate them more about what other services are available in addition to the healthcare plans.
Doing it during marketplace open enrollment would probably be the most successful, so that if marketplace was the best answer, it would be available at that time.
Anyone else? Well, I want to thank everyone for attending today. Great conversation. I really appreciate the time of our panelists and for everyone who attended. I will let you know that there will be a follow-up email coming with an evaluation, as well as a resource list and copies of slides, things of that nature. I do also want to invite you to join. We will be doing this is our our 5th session in this series, and we do have one coming up in June 7th about Medicare. and the Shine program. So I really, even if you're not personally getting ready to get Medicare, there are some things that will be helpful to know. And if you have friends or family members who are approaching that age or who are already in the process, the information that will be provided will be very helpful to get a sense for what you need to be planning for and what your options might be. Any final questions? Oh, there's one just popped up here. Let's see what we have here. Oh, that says thank you. Kim says thank you. So we look forward to having this conversation again at another time when hopefully the event will be, let's celebrate all the great work we've been doing. So thank you again for your time, and we look forward to seeing you next June, on June 7th. Thank you.
Thank you. Thank you to our panelists and for everyone attending. We appreciate it.
Thank you.
Have a great rest of your Friday.